Hi all, welcome to the new video. Today I am here to talk about chemical regulation of respiration. So the chemical changes to oxygen, the carbon dioxide and the hydrogen ion, means the H plus ion, is what the chemical regulation is all about. So it is actually mediated by the receptors known as chemoreceptors. So chemical regulation of respiration can be again classified into central chemoreceptors, peripheral chemoreceptors. So the chemoreceptors can be divided into central chemoreceptors and the peripheral chemoreceptors. The central chemoreceptors are very sensitive to the carbon dioxide changes, whereas peripheral chemoreceptors are sensitive to the oxygen changes. So one by one, first we will summarize what is where it is located, where are the chemoreceptors located, and that is what I am going to tell you first. So first one, central chemoreceptors are present exactly in the brain, specifically saying in the medulla. Where in the medulla? The ventral surface of the medulla along with the floor of the fourth ventricle. So central chemoreceptors are present in the medulla, in the ventral surface of the medulla along the floor of the fourth ventricle. And where what is it sensitive to? The central chemoreceptors are sensitive to the carbon dioxide changes, means the hypercarbia, increase in the carbon dioxide, hypercarbia. Whereas peripheral chemoreceptors are present peripherally, mainly you can say in the neck region. Okay, it's present in the neck region, and we have aortic and carotid bodies. We have bodies here. We have all studied about baroreceptors. As a class I didn't take, but baroreceptors are there for regulation of BP. So in the baroreceptors we have carotid, sinus and aortic arch. So instead of sinus or arch we have bodies here. So we have carotid body as well as aortic body in the neck region. It is considered to be the peripheral chemoreceptors, and these peripheral chemoreceptors are sensitive to the oxygen changes. Okay, now coming one by one, first we'll discuss about central chemoreceptors. So what is this central chemoreceptors? The central chemoreceptors are the chemoreceptors present in the medulla, the ventral surface of the medulla along the floor of the fourth ventricle, and this central chemoreceptors are sensitive to the carbon dioxide changes. Okay, that is hypercarbia. And the most important regulating factor all among the regulation of respiration is the carbon dioxide. Keep in your mind, the most important regulating factor among all the regulation of respiration is the carbon dioxide. Consider a blood vessel to have carbon dioxide and H plus ion. The H plus ion cannot cross the blood-brain barrier. It has to cross the blood-brain barrier to reach the brain. And the carbon dioxide can cross easily. So actually what is the ultimately stimulating the chemoreceptors is, it is the H plus ion. The hydrogen ion is the one which stimulates the central as well as the peripheral chemoreceptors. So we need H plus ion here. So suppose in the blood vessel we have carbon dioxide and H plus ion here in the blood vessel. It has to move and cross to a brain. This is brain. Suppose consider this to be brain. This is blood vessel. So this carbon dioxide and H plus ion in the blood vessel, both of them cannot cross, because H plus cannot cross the blood-brain barrier. We have a barrier in between the blood vessel and the brain as a blood-brain barrier. The carbon dioxide can cross the blood-brain barrier and can reach to the brain. And here in the brain, the carbon dioxide can combine with a molecule of water, forming carbonic acid with the help of carbonic anhydrase enzyme. And this carbonic acid, that is H2CO3, dissociates into H plus and SCO3 minus ion. So we get a H plus there. So in the brain we have H plus now. This can directly stimulate the respiratory centers. So I'll just repeat it. You can just, this is the blood vessel. This is blood vessel where we have carbon dioxide and H plus ion, and we have a brain here, that is, and in between the brain and the blood vessel we have a blood-brain barrier. So the carbon dioxide in the blood vessel can cross the blood-brain barrier and can reach the brain, and there it combines with a molecule of water. It forms carbonic acid with the help of carbonic anhydrase. This carbonic acid dissociates into H plus ion and SCO3 minus ion. The H plus ion, what we get in the brain, exactly saying in the CSF, is the one who stimulates the respiratory center. So the H plus ion in the blood vessel cannot cross, but H plus ion in the brain can have a stimulation directly to the chemoreceptors. So that is what about central chemoreceptors. Okay, coming to the peripheral chemoreceptors. Peripheral chemoreceptors, I told you, it is sensitive to oxygen changes. It is sensitive to hypoxia. Okay, central chemoreceptors was hypercarbia, peripheral chemoreceptors was hypoxia. Okay, so oxygen changes, hypoxia. So we have oxygen sensor cells in the something known as, specifically known as glomus cell. So in the peripheral chemoreceptors we have something known as glomus cell, which is called as oxygen sensitive cells. So what happens in glomus cell? So now we can tell about the mechanism of glomus cell. What happens in glomus cell? Okay, and I told you, as earlier I told you, we have carotid bodies, aortic bodies in the peripheral as a peripheral chemoreceptors. It is located in the neck region. Okay, it is sensitive to oxygen changes, so we have hypoxia. So what happens in the glomus cell? So normally the glomus cell have oxygen sensitive potassium channels. There is oxygen sensitive potassium channels present in the glomus cell. So what happens when there is hypoxia? When there is hypoxia, the oxygen sensitive potassium channels in the glomus cell, it's blocked or it is inhibited. Okay. So once it is blocked, what happens? There is a more and more potassium channel present inside the cell. The deposition of potassium channel will be more inside the cell, leading to a condition known as depolarization. Not a condition, it is a process. Depolarization happens when there is more and more potassium accumulating inside the cell. So as a result of depolarization, in the cell there is an opening of a new channel called as calcium channel. The calcium channel opens and this results in the entry of calcium ions into the cell. And this calcium ions releases a neurotransmitter, specifically saying a neurotransmitter called as dopamine. Well, let's repeat it once more. We have a glomus cell, we have oxygen sensitive potassium channels in the glomus cell, and when there is hypoxia, the oxygen sensitive potassium channels are blocked or inhibited, and as a result the potassium ions gets accumulated inside the glomus cell, and this can result in depolarization. As a result of depolarization, the calcium channels opens and the calcium ions gets inside the cell, and this releases a neurotransmitter called dopamine. The signals are sent to the brain and it conveys the brain that this has happened. Okay, so it is a signal what will be given by the dopamine. Okay, so now that's about the peripheral chemoreceptors. So we have central chemoreceptors, we have hypercarbia, also H plus ion is increased, acidosis, whereas in peripheral chemoreceptors we have hypoxia. So when you combine these three things, hypercarbia, hypoxia and increased H plus ion, that is acidosis, we get a condition called as asphyxia. So asphyxia is a combination of hypercarbia, hypoxia and increased H plus ion, that is acidosis. Okay, so asphyxia. So what happens when there is asphyxia? The chemoreceptors are stimulated, the central as well as the peripheral chemoreceptors are stimulated, and this can lead to a condition. What happens when there is a chemoreceptors are stimulated? There is something known as chemoreflex. The chemoreflex takes place. The chemoreflex can lead to hyperventilation. What happens in hyperventilation? When there is hyperventilation, there is carbon dioxide washout taking place. So as a result of chemoreflex, the hyperventilation takes place. The hyperventilation can cause, during hyperventilation what happens? There is a carbon dioxide washout. So what happens when carbon dioxide washout is there? There is a decrease in the carbon dioxide ion, decrease in the H plus ion. Also simultaneously we have increased ventilation, hyperventilation, increased ventilation taking place, increased oxygen uptake. So we have an increase in oxygen content. So when we have hypercarbia, hypoxia and acidosis, it is together called as asphyxia. As a result of asphyxia, the stimulation of the chemoreceptors, the central as well as the peripheral chemoreceptors, this can lead to a reflex, initiation of a reflex known as chemoreflex, which can lead to a hyperventilation. As a result of hyperventilation, there is a carbon dioxide washout and increased ventilation taking place. We have decrease in the carbon dioxide ion, decrease in the H plus ion and increase in the oxygen level, oxygen content. So it becomes ulta. Okay, so this is about the regulation of chemical regulation of respiration. So I'll just tell you summarizing thing. We have central chemoreceptors, peripheral chemoreceptors. Central chemoreceptors are present in the medulla, exactly saying the ventral surface of the medulla along the floor of the fourth ventricle, and it is sensitive to carbon dioxide changes. So there is a hypercarbia as well as H plus ion increases there. So peripheral chemoreceptors are present in the neck. Peripherally in the neck we have carotid and aortic bodies which is sensitive to oxygen changes, that is hypoxia. So this is the highlight of the thing. So central chemoreceptors are sensitive to carbon dioxide changes, peripheral chemoreceptors are sensitive to oxygen changes. This can be asked as MCQ also, several times it can be asked as MCQ. So both of them together increase in H plus ion. The H plus ion is the one which stimulates both the central as well as the peripheral chemoreceptors. Keep in your mind, H plus ion stimulates both the central as well as the peripheral chemoreceptors. Okay, this you have to keep in your mind. That's an important MCQ area. Sensitivity to central chemoreceptors, carbon dioxide changes. Sensitivity to peripheral chemoreceptors, it is oxygen changes. Whereas stimulatory to both the chemoreceptors, H plus ion. Okay, and the most important regulating factor is carbon dioxide. Okay, so these are some of the MCQs that can come along in this topic, chemical regulation of respiration.